Hello and welcome to this YouTube video. Today I'm going to be talking about placement essentials for medical students. If you're starting placement soon, or even if you'd like a refresher on what to take to placement in case you forget sometimes like me, then this video is for you. There'll be a free list in the description for you to download, and that will be a checklist of all the things you need for placement. So the first essential will be your stethoscope. This one goes without saying. You could need your stethoscope anywhere. Some specialities you'll need it more than others. For example, if you're on an acute internal ward or anywhere where you need to do cardio exams, resp exams, or even abdo exams, of course you'll probably need your stethoscope. It's probably better to have it just in case you want to practice any skills anyway. It's just a good one to have. So bring your stethoscope, guys, little reminder. The second thing will be to bring some device. This could be, I like to bring my iPad because it's quite handy on the go, and also it's like it's big enough for me to open the websites where I need to get sign-offs done. Like it's quite handy in that sense as well. But you could also use your phone. But yeah, this is just like a personal preference, but something where you can get sign-offs done. And a little side note about sign-offs would be, ideally, this is just my opinion, but I think you should get sign-offs done on the same day that you've done the skill, ideally. So it's quite nice if you can fill out the sign-off document on the same device as the person who signs it off. So try to have something ready so that the person who's signing you off is able to type onto your iPad or phone, like select whatever options, like whether your skills were satisfactory. It just saves you a lot of chasing things up and then having to do the skill again, even if you've done it up to the required level. The next tip would be arguably the most important tip. And before I say what it is, I'd just like to ask you to like and subscribe if you've watched this far already. This is a brand new YouTube channel and I'd really appreciate your support. So yeah, if you'd like to help this channel grow, please do like and subscribe and turn on the notification bell so you receive a notification when I upload another video. So the next tip is to make sure that you have a plan for what to do when you go to placement. So for example, you're probably going to be assigned a timetable, which is roughly where you need to go, which ward, which doctor you need to shadow. So think about in advance whether you want to take a history, or you want to do an examination, or you want to observe a procedure or a surgery, or whether you want to get some sign-offs done or do some bloods. Try and have a plan in advance. In my experience, when you're proactive in this way, you're going to get the most out of placement, and it will really help you to stay on top of your sign-offs as well. So yeah, make sure you have a plan for what you want to do on each day. So just have a look at what you have left and also just what you feel less confident in. And this is also the best way to stay on top of OSCE prep, because the best way to practice for OSCEs is to actually take histories from real patients. So yeah, loads of opportunities for revision there. So the next tip is make sure you have your water bottle with you on placement. Yeah, I know this is bright pink, it's my favorite color, can you tell? Jokes aside, you need to make sure that you are adequately hydrated on placement, because there might be some instances where you're standing around the bedside, which is understandable. So you just want to make sure that you're feeling as healthy as possible. So yeah, make sure you take your water bottle with you on placement, and yeah, that's just a really important point. The next one is, I'd say the jury's still not out on whether this is better, but make sure that you take a notepad and a pen. If you feel that you're more comfortable writing notes, some people say that it looks more professional on the bedside, like when you're making notes from a notebook. But yeah, whatever you do, friendly reminder, make sure you don't put anything identifiable about the patient. That goes without saying. Protect the patient's confidentiality. But yeah, and if you feel like you're already taking your iPad for sign-offs, and you might just feel like, oh, it might just be easier to take one thing with you, one placement. But yeah, it can be really handy to have a notepad and pen. So that's just another option. So the next tip will be to take something for you to revise when you go on placement, or just something to do, because you might be waiting around at times. Obviously, it's a really busy environment on the wards, so sometimes, you know, when you're waiting for teaching, it's handy to just have some flashcards with you. These are Netta's cards, but you can have literally any flashcards will do. You can even have virtual flashcards on your phone, like on Anki or something. So yeah, just have something to revise, because honestly, I think you'll make the most out of little pockets of time you get. And you'll probably notice that as a medical student, you get increasingly busy, and then there's not that much time to revise. So these are the moments where you can make the most of any time you have and just revise little and often. I'd also say that it's probably a good idea to bring some hand cream if you have dry skin, because you'll probably be sanitizing your hands a lot. So yeah, thanks for watching this far. Like I said earlier, this is a brand new channel, so yeah, please do like and subscribe, show your support, and yeah, let me know what you'd like me to talk about in future videos. I'm happy to talk about hospital placement, exams, or intercalation, because I'll be doing that in the coming year. So it'll be a little bit different to the main course, but I'm really looking forward to it nevertheless. So yeah, thank you so much for watching, and I'll see you in the next one. Bye!